She said she was dizzy.
Did you tell Dr. Lawrence about these calls?
I put her on hold both times and told Dr. Lawrence what she was saying. He said he'd call her back.
And did he?
No.
That's her moving.
Did he return any calls that afternoon or evening?
That's her moving in my belly going, no.
To say he was running late.
The pergola?
The restaurant. He was having dinner there before going to a show.
Nothing further.
Miss Hackett had seen Dr. Lawrence for surgery before, hadn't she, on several occasions?
Yes.
And after each one of her previous surgeries, did she call him?
But
Yeah,
Dr.
she's
Lawrence
moving
asked
right
all
now.
of his patients to call after surgery.
That's
to
her.
check in.
And how many times would they call, typically?
Once or twice.
What about Miss Hackett?
2-3 times. Sometimes more.
For what reason?
To complain.
This is my
How she
belly
was
button
feeling.
right here
Her stitches
and
were
my
too
left
tight.
side.
She was groggy.
And you can tell
nauseous,
she's
that
really
kind of thing.
sticking out.
Did she ever
I'm all
complain
funny
about
looking.
Sometimes headaches.
There she
tenderness.
goes.
Did Dr. Lawrence speak with her?
Usually, yeah.
And in response to her complaints, what would Dr. Lawrence usually prescribe?
Usually aspirin and bed rest. This was a more serious surgery,
There,
so he
see?
prescribed Dental.
So she was a complainer.
You could say that.
Is that how you and your coworkers thought of her, as a complainer?
We used to say she was high maintenance.
That's her moving.
Did
It's
you
not me
read the
breathing.
decedent, Nora Hackett,
Okay, there,
aka
that's me
Courtney
breathing, but
King?
No.
Then what is the basis of your professional opinion?
The methodology of case study. You review the full scope of her medical records, you interview family members, friends, colleagues, even the doorman.
And were you able to make a diagnosis?
Based on all the available data, it's very likely that Nora Hackett
Oh.
suffered from body dysmorphic disorder, an obsessive preoccupation, a fixation on a perceived defect in one's physical appearance.
Is
That's
it
her moving, not
that
me.
only a psychologist or a psychiatrist is trained to deal with?
Yes, but all medical students are trained to diagnose it, especially plastic surgeons, because they encounter it with much more frequency.
And if you have a patient with symptoms of body dysmorphia,
It's the responsibility of the surgeon to insist on a psychiatric consult before performing surgery.
according to the medical records, did Dr. Lawrence ever,
they're not kicks either. That's her just like moving around in there.
ever send
Like a
Nora
little baby.
Hackett for a psychiatric consult?
No.
You're with
Mirror, mirror on the wall, who is the most beautiful of them all? Where to start? A preoccupation with a perceived physical defect. It sounds so mushy. Isn't it almost too subjective to diagnose? Not when the patient tells everyone that her biggest problem is being fat or ugly,
There she moved
and then
again.
subjects herself to frequent and multiple major surgeries. There were more than 8 million elective cosmetic surgery procedures last year in this country alone. Are all of those patients body dysmorphic?
She's really shoving out.
Nora Hackett was.
Like pushing out. Oh, there, she's pushing
Is there
stuff.
anyone in this room who is satisfied with the way you look? You're trivializing a serious illness. Aren't you infantilizing women?
I wonder if you can see, like, that's where she's pushing right over here.
Not if the patient suffers from delusions that diminish her judgment. Would you prescribe diet pills to someone who suffers from anorexia because she thinks she's fat? Plastic surgery is serious business. So is abortion. Would you give doctors the right to require women to have a psychiatric consult before scheduling an abortion?
objection relevant.
No, I'll answer. If a physician observes symptoms of mental illness, there is a clear obligation to try to get the patient help before performing an abortion, plastic surgery, or any other elective.
She's like trying to make me let her go outside.
Disputes that diagnosis. Do we forbid her to choose? Never mind. It's all academic.
Here she comes. She's gonna come around and beg. 'Cause she wants to go outside and see what's underneath the deck. Are there rabbits? She's gonna go walk towards over there. And wait to see if I'll let her out.
Cosmetic surgery.
Okay, that's it.